Major health problems in urban, rural, and tribal. Major health problem in urban. In urban area, rapid population growth, lifestyle changes, environmental factors, and urbanization contribute to a variety of health challenges. Here are major health problems typically faced by urban populations. 1. Non-communicable diseases (NCDs), cardiovascular diseases, conditions like heart disease, hypertension, and stroke are prevalent due to sedentary lifestyle, unhealthy diets, and stress. These diseases are a leading cause of death in urban area. Diabetes, type 2 diabetes is common, often linked to poor dietary habits, high in processing foods and sugar, and lack of physical activity. Obesity, high rates of obesity in urban population due to sedentary work environments, easy access to fat food, and low physical activity. 2. Environmental health issues. Urbanization often leads to increased stress, social isolation, and poor life balances, contributing to higher rates of mental health disorders like depression, anxiety, and substance abuse. The pressures of urban living, such as overcrowding, job stress, and high cost of living, also contribute to mental health challenges. 3. Respiratory diseases, air pollution. Urban areas have high levels of air pollution from vehicles, factories, and industrial emissions, leading to respiratory diseases like asthma, chronic obstructive pulmonary diseases, and lung infections. Indoor air pollution, poor ventilation in homes, exposure to tobacco smoke, and indoor chemicals can exacerbate respiratory problems. 4. Infectious diseases. Although urban areas generally have better healthcare facilities, the high population density and global travel contribute to the spread of infectious diseases. These include tuberculosis, TB, urban slum with inadequate sanitation contribute to higher TB incidence. COVID-19, highly contagious respiratory infections, including COVID-19, spread rapidly in crowded cities. HIV/AIDS transmission risk in densely populated areas with higher rates of sexually transmission and intravenous drugs use. 5. Accidents and injuries. Urban areas see a higher rate of traffic accidents due to dense traffic, poorly regulated roads and inadequate safety measures, workplace injuries, accidents in homes, and violence related to injuries, example assault, are more common in urban settings. 6. Substance abuse, alcohol and drug abuse, including opioids, cocaine, and prescription drugs, are significant problem in urban centers leading to mental health disorders, violence, and societal harm. Substance abuse often coexists with other social issues such as homelessness, poverty, and unemployment. 7. Environmental health issues, urban heat islands, cities experience higher temperature than surrounding rural areas, which can exacerbate health problems. 8. Obesity and poor diet. The availability of cheap, high calorie processed food in urban areas contribute to a rise in obesity and related conditions like diabetes and hypertension. Malnutrition also occur in urban areas due to poor dietary choices, especially in low income populations. 9. Sexual and reproductive health, sexually transmitted infections, STIs, high rate of STIs, example syphilis, gonorrhea, chlamydia, and HPV due to unprotected sex, multiple sexual partners, and limited access to sexual health education in some urban population. Teenage pregnancy in some urban areas, especially in low income or marginalized communities, early pregnancy rates are high due to lack of sexual education, economic instability, and limited access to contraception. 10. Health inequality and access to healthcare. Health disparity, urban population often experience significant inequality in healthcare access, while some urban areas have state of the art hospitals. Low income neighborhood or slum may have limited access to healthcare facilities, leading to poor health outcomes. Health insurance and financial barriers. A significant portion of the urban poor may not have health insurance or the financial means to access quality health care, which can result in untreated chronic conditions, delayed diagnosis, and worse health outcomes. These health problems are often interconnected and influenced by various socio-economic, environmental, and lifestyle factors. According to urban health challenges requires comprehensive solutions including improving infrastructure, promoting healthier lifestyle, improving mental health services, and ensuring that all urban residents have access to equally quality health care. Major health problem in rural areas face a unique set of health challenges due to factors like limited access to healthcare, poor infrastructure, and economic disadvantages. Here are major health problems commonly seen in rural communities. 1. Limited access to healthcare facilities. Many rural areas lack adequate healthcare infrastructure, including hospitals, clinics, and healthcare professionals. People often have to travel long distance to access healthcare, which delays treatment and leads to worse outcomes. A lack of specialties. Rural areas typically have a shortage of specialized healthcare providers, meaning people with complex conditions may not get the treatment they need. 2. Infectious diseases. Malaria, due to environmental factors such as stagnation of water and poor sanitation, malaria remains prevalent in many rural regions. Tuberculosis (TB), inadequate healthcare facilities and delayed diagnosis lead to higher rate of TB in rural areas. Diarrheal diseases, poor sanitation, lack of clean water, and inadequate hygiene facilities lead to higher risk of disease like cholera, dysentery, and other waterborne diseases. Dengue, rural areas with poor waste management and improper drainage systems can be breeding ground for mosquitoes, leading to the spread of diseases like dengue fever. 3. Maternal and child health. High maternal mortality, limited access to maternal care, skilled birth attendants, and medical facilities contribute to higher maternal mortality rates. Infant mortality. High rates of infant mortality are often linked to poor prenatal care, inadequate nutrition, and lack of postnatal support in rural areas. Malnutrition. Both maternal and child malnutrition are prevalent due to limited access to nutritious food, poverty, and lack of awareness about healthy diets. 4. Nutritional deficiencies and malnutrition. First, iron deficiency, anemia. Rural populations, especially among women and children, face a higher risk of iron deficiency. Anemia due to poor diet and lack of access to iron rich foods. Stunting and wasting. Malnutrition leads to stunted growth, underweight children who suffer from long term physical and cognitive development issues. Vitamin A deficiency. Rural children, particularly those in poor families, suffer from vitamin A deficiency, which can lead to blindness, and weakened immune system. 5. Occupational health risk. First risk, agricultural work hazards. Many rural populations depends on farming, which exposes them to pesticides, chemicals, and heavy physical labor. These can lead to respiratory diseases, skin disorders, and long term health problems like cancer. Injuries. Rural workers, particularly those involved in farming or construction, face a high risk of accidents and injuries due to unsafe practices, lack of protective gear, and inadequate safety measures. 6. Respiratory disorders and diseases. First, chronic respiratory diseases. Rural populations are often exposed to smoke from cooking with biomass fuel, example wood, coal, which contributes to conditions like chronic obstructive pulmonary disease, COPD, asthma, and respiratory infections. Dust and pesticides. People working in agriculture or living near industrial farms may experience respiratory problems due to exposure to dust, pesticides, and other chemicals. 7. Mental health issues. Depression and anxiety. Rural communities face significant mental health challenges, often linked to isolation, economic stress, and lack of mental health services. The stigma surrounding mental health may also prevent individuals from seeking care. Suicide rates, especially among farmers facing economic hardship, have been reported to be higher in rural areas. The lack of mental health support and access to counseling services exacerbate the problems. 8. Chronic diseases, hypertension, and cardiovascular diseases. Rural areas often have higher rates of untreated hypertension, cardiovascular diseases due to limited access to healthcare and lack of awareness about preventive care. Diabetes, type 2 diabetes become more prevalent in rural areas, particularly due to poor dietary habits, lack of physical activity, and limited access to health care for management and treatment. 9. Water and sanitation issues. Poor sanitation may many rural communities lack proper sewage systems, leading to contamination of water sources, which contributes to range of waterborne diseases like cholera, dysentery, and gastroenteritis. Access to clean water. Inadequate access to safe drinking water is critical issue in rural areas, leading to frequent outbreak of waterborne diseases. 10. Health inequality and health education. Health disparities. Rural populations often face worse health outcomes compared to urban population due to a lack of healthcare infrastructure, low health literacy, and greater social and economic vulnerabilities. Lack of health education. Many rural residents lack basic health education, which limits their ability to prevent diseases, manage chronic conditions, and access healthcare services. These health issues in rural areas are often compounded by factors such as poverty, limited transportation, lack of awareness, and an overburdened healthcare system. Addressing these health problems requires targeted interventions, including improving healthcare infrastructure, increasing access to clean water and sanitation, providing better maternal and child health care, and addressing occupational and environmental health risk. Major health problems in tribal communities often face a distinct set of health challenges due to their geographical isolation and socio-economic status, cultural practices, and limited access to healthcare. These communities, which are usually found in remote areas, struggle with health problems that are compounded by the lack of resources, education, and health infrastructure. Here are major health problems commonly faced by tribal population. One, limited access to healthcare. Healthcare infrastructure. Many tribal areas lack of adequate healthcare facilities, hospitals, and trained healthcare professionals. People may have to travel long distance to access medical services, which can delay diagnosis and treatment. Traditional medicine. While traditional healing practices are important in tribal communities, they may not always be effective in treating modern diseases or emergencies, and reliance on them can delay proper medical intervention. To infectious diseases, malaria, tribal population often live in areas with stagnant water, creating breeding ground for mosquitoes. Malaria remains one of the most prevalent diseases in tribal regions, especially in rural and forested areas. Tuberculosis, TB, limited access to healthcare, poor nutrition, and crowded living condition in some tribal communities contribute to high rate of TB. Dengue, like malaria, dengue is common in areas with poor sanitation and inadequate mosquito control, leading to periodic outbreaks. Diarrheal diseases, poor sanitation, lack of access to clean water, and inadequate hygiene lead to frequent outbreak of waterborne diseases like cholera, dysentery, and other gastrointestinal infections. Leprosy. Although less common today, leprosy still affects some tribal populations, particularly partially due to delayed diagnosis and treatment. 3. Maternal and child health. High maternal mortality. Maternal health is a significant issue in tribal communities due to inadequate parental care, a lack of skilled birth attendants, and poor access to emergency obstetric care. This leads to higher rate of maternal mortality. Infant mortality rate is are higher in tribal areas due to factors such as poor nutrition, limited access to medical care, and lack of immunization. Undernutrition. Children in tribal communities are at high risk of malnutrition, which can lead to stunting, wasting, and developmental delays. Poor access to nutritious food in major factor. For nutritional deficiencies, micronutrient deficiency, tribal population often suffer from deficiencies in key nutrients such as iron, vitamin A, iodine, and vitamin D, leading to conditions like anemia, night blindness, gout, and weakened immunity. Malnutrition due to limited access to a balanced diet and poor food security. Tribal children and adults often experience malnutrition, which lead to stunting, delayed growth, and poor cognitive development. 5. Respiratory and environmental issues. Indoor air pollution. Many tribal communities rely on traditional cooking methods using biomass fuel like wood, coal, and dungs. This leads to indoor air pollution, which can cause respiratory diseases such as chronic obstructive pulmonary disease, COPD, asthma, and lung infections. Water contaminations, lack of access to clean drinking water, and inadequate sanitation facilities are major contributors to the spread of waterborne diseases. In some areas, water sources are contaminated with arsenic, fluoride, and other harmful substances, leading to long term health problems. 6. Mental health issues. Mental health stigma. Mental health is often taboo subject in tribal communities, and there is a lack of awareness about mental health conditions such as depression, anxiety, and stress. This lead to untreated mental health problems and social isolation. Substance abuse. In some tribal areas, there is high prevalence of alcohol and substance abuse. The economic hardship and social isolation that may tribal communities face and exacerbate these problems. 7. Chronic diseases. Non-communicable diseases. Tribal population have lower rates of healthcare access, which means chronic disease like hypertension, diabetes, and cardiovascular diseases are often undiagnosed and untreated until they become severe. 8. Occupational health risk. Agricultural hazards. Many tribal people depends on farming, which exposes them to pesticides, herbicides, and other chemicals. These chemicals can lead to skin disorders, respiratory issues, and long term health effects like cancer. Workplace injuries, tribal communities engage in manual labor, hazardous occupations like mining, logging, or construction face a higher risk of accidents and injuries, often due to lack of safety equipments and poor working conditions. 9. Health inequality and health education. Health inequality. Tribal populations often face health disparities due to limited access to healthcare, low literacy levels, and social stigma. They often receive lower quality of care compared to general population. Low health literacy, limited education and health awareness in tribal communities or areas lead to a lack of understanding of preventive healthcare measures such as immunization, hygiene practices, and the importance of regular medical checkups, etc. 10. Displacement and loss of traditional lifestyle. Displacement. Many tribal communities are displaced due to infrastructure projects, industrialization, and urban expansion. The disruption of their traditional way of life can result in poor mental health and physical health. Loss of access to traditional medicines and exposure to new environmental health risk. Loss of cultural practices as traditional population are integrated into urban settings or exposed to outside influences. Their traditional knowledge about medicine, food, and health is often lost, leaving them more vulnerable to disease and health risk. Addressing health issues in tribal efforts to address these health problems in tribal communities need to focus on improving healthcare access, establish more health facilities, increasing mobile health services and training, community health works to reach remote areas. Cultural sensitivity, understanding and integrated traditional healing practices with modern healthcare approaches where possible to build trust and improve health outcomes. Nutrition programs provide better access to nutritious food services and supplements, and education on healthy diet. Education and awareness. Implementing health education programs to improve knowledge about hygiene, nutrition, maternal health, mental health, and disease prevention. Infrastructure development. Improving sanitation, clean water supply, and housing condition to reduce the spread of infectious diseases. Mental health support, raising awareness about mental health, reducing stigma, and providing counseling services in tribal communities. Overall, improving health outcomes in tribal areas requires a holistic approach that respects cultural practices, addresses the social determinants of health, and ensures equitable access to healthcare. Thank you. Have a nice day.